next amazing speaker in the house is Nikita Vizniak, Dr. Nick. Dr. Nick comes to us from Canada. Look at you all dressed up in a suit. That's awesome. Thanks for, oh, you're muted. You're muted, Dr. Nick. We want to hear from you. So while you're unmuting, I just want everyone to know you are more than a chiropractor. You've got like 75 different credentials. So I feel like you could talk to everybody. And I'm leaning, my elbow's literally up at shoulder height, leaning on a stack of goodies that you sent me. You sent me like, you have filled my reference library. You guys look at this. This is all from Dr. Nick. He just sent me the biggest box. I went to go pick it up at the post office and I thought, what? Yeah, like what is all of this amazingness? So I hope you get to share with us a little bit about that. I know you have so much to share with us, Dr. Nick. Thank you for being here today.
Thank you so much for having me, Gina. Fantastic to be here today, in fact. And I think that's sad. If that's the only time you guys were standing, I think everybody needs to stand up right now. Let's all just stand up again. Now, have we all seen a show called The Simpsons? We've all seen that show before. So basically, there's a character on there called Dr. Nick, and he goes, "Hi, everybody." And then everybody back goes, "Hi, Dr. Nick." So let's go ahead and try that right off the bat. If you do this, it will make you smile and you will be happy if you do this. Okay, so we're standing up. And we're going to go with it. And I'm going to start it off. "Hi, everybody." And what do we all say?
Hi, Dr. Nick.
Hi, Dr. Nick. All right. Hopefully we've seen the research out of Harvard where if you even stand up, putting your hands above your head like this is a power pose that actually reduces cortisol levels and increases positive mood. So fantastic for us to toss that in there. And even better, put your hands above your head and do a deep squat. Okay. All the way down. And the form doesn't even matter that much as long as you move. That's the key thing for us to get. All right. So yeah, so Gina, I sent you a whole bunch of goodies right there. Why don't you pick your favorite one? What was the one that you liked the most that I sent you? Oh, okay. Yeah. Open it up so everybody sees it. All right. Interesting.
I need to know more about this and we get to talk about what this is exactly. And by the way, well done on your product line.
Thank you.
Like super inspiring to me. I clearly need to raise my level on my game a little bit here.
Yeah. So what do we have right there? You're looking at a instrument assisted technique set right there for rolling through the skin and different things like this. So deeper into muscles, more specific contacts. We actually have online courses available, but I do one every 3 months here locally. So yeah. Thumb savers. My thumbs, hold that other one up again.
This one, the last one?
Yeah, because that literally, my thumbs ache from so much pin and stretch and working onto people and everything like this. So if you look at the shape of that, I'll just pull it down from right here. That is literally designed as the shape of my thumb. And so the neat thing about me is I'm an everyday normal guy, so it fits like 90% of the population. That's literally the shape of my knuckle right there. This goes into the spinal laminar groove up and down like an Egyptian headrest that you can see from like 5,000 years ago. So yeah, basically a hand saver right there for sure. So yeah.
Dr. Nick, question for you. We were talking about scopes of practices during the summit, of course.
Yep.
How safe, applicable, legal is it for non-manual practitioners to use these tools? Is it still considered manual work if they're using these tools, or is this their intermediary?
Well, so that's an interesting point to make there. So ultimately, it's dependent on state by state bylaws and local scope of practice and everything. But you see anybody from personal trainers all the way up to medical doctors and, TCM docs, chiros, physios, massage therapists, all using these instruments as a way to get more specific and get deeper into the tissue. The problem is, if you don't have good training, you can actually hurt people with these because you are so much more powerful than just using your hands. Like the dosing into the tissue is way higher than it would be with just your hands. So when I give a seminar on it, what I usually do is first dose is ultra light because you're never 100% sure how somebody's going to react to it. So you're ultra light, just basically, ruling through areas of thick muscle like upper traps through the erector spinae that are like that thick, or quads or something. But yeah, it's in scope of practice for the vast majority of the population. And in fact, you can buy knockoffs that are cheaper versions too, that even just general people can use as well. Having said that, I've had patients do this before where can I just grab a fork or something? And they've actually worn themselves raw trying to scratch in and get into a deeper area or something. So you have to watch out for those things happening in the future potentially as well.
Yes, that's why we have all the warning labels on things like that now.
Yes, yeah, exactly. Nice. All right. So what did you want me to talk about today?
Well, I want to know what your favorite is in the stack of amazingness. What is your favorite? And can you share with us more about it?
Oh yeah, totally. My favorite actually is the muscle manual. We just got a brand new version of it. But so we just printed this off, but basically you can pick any muscle. So what do I have here? Well, I just randomly open up the subscapularis, and on a 2-page spread, you get to see the muscle, some notes about it for anatomical variation. How do I palpate it? How do I muscle test it? Trigger point referral patterns and exercise therapy and rehab is all there for every muscle in the body on a nice 2-page spread. So you can keep on running through. So it's good for education as a practitioner, good for education as a patient. And I'm going to flip this around so you can see my setup here a little bit. Shazam. It's all of these exercises are now in the new edition. So over 1,000 exercises, just making it nice and simple for clients to get the basics of function out of this. Yeah.
Amazing.
Yeah.
How do you have time to see clients and patients is my question.
Oh yeah, that's everybody asks that. We're actually in the middle of doing a contract with the Canadian Chiropractic Association. They want our content for all of their members so everybody can use it. So it'll be like 10,000 members that'll be using it. But what I do is I split my time up between 4 different things. Okay. So number 1, it's going to be family. I have 3 cute little girls that boss me around all the time. So that's number 1. If you see my Instagram, you'll see this morning, my favorite thing to do. The name of that book I see there on the comments is Muscle Manual, but my favorite thing to do is to give my kids a bike ride or walk to school in the morning. So that's how I spend a quarter of my time. I spend a quarter of my time teaching. So I teach at a number of universities and colleges locally here, as well as doing seminars in person for people for continuing education. Another quarter of my time is spent in practice. And then another quarter of my time is spent doing the research and writing that you see behind you here. So just dividing it up like that, trying to find balance within all of that stuff. I do have a pretty busy, I don't know. I can't sit still is the bottom line. Okay. I do have ADHD if you want to know the truth behind it. So I just can't sit still. I got to be doing something productive all the time, basically.
Way to maximize on your uniqueness though. I love it. I love it.
Yeah. That's what people tell me. I have the most directed ADHD they've ever seen. So yeah.
That was fantastic. I was talking to one of our mutual colleagues this week and they were sharing with me that if there's a meeting with you and it's over at 4, if they come back to you at 4:01, you're gone.
Yeah, absolutely.
You have something else at 4:01. And so you're very regimented in that way. I was like, wow, that is so inspiring. I want to be more like that when I grow up.
There you go. When I grow up too, I want to be like that.
So Dr. Nick, what do you think we need to know? It's like a super big question. I get it. What do you think we need to know at this juncture, wherever we are on our path, about pain and injury? What is the most current thing on your heart right now that you think practitioners get to wrap their hands around? I guess pun intended.
Am I okay to do a share screen with you guys? Is that all right?
Yeah. Let me make sure that I have settings for that. Yes, you are able, and okay. Have I allowed you is the question. There you go. Go for it. Okay.
So I think the biggest thing, I'll just say right off the bat, the biggest thing that we can do is help people realize they are not alone in what they're going through. And that's the simplest level that I would put it at right there. So I'll share screen here in just a second, try and get to this right thing. So you should be looking at a copy of the massage therapy book that we just finished up. That you're seeing the cover of it right there.
Yeah.
So I'm into, let me just zoom out here just a little bit. So I'm going to go into this assessment chapter right here and skip ahead just a little bit. So basically what happens for a lot of people when they get into pain areas, they get into areas where they can't move, they feel disheartened, they feel pretty negative. There's a whole bunch of stuff here on how to take a patient history. I'm looking for one page in particular, actually, is they feel isolated and they feel alone. And it actually goes down to this model right here, a fear avoidance model in chronic pain. It's the simplest thing that I do. What I've done is I also print off, I used to give my patients full books, and patients don't actually want the entire books. What I would give them is just little print offs now. So if somebody comes in with low back pain, we give them this little 100 pager right here that kind of walks you through it, or we have them for shoulder pain and all that. But every book has this laid out inside of it. And I'll actually walk through it with patients. So let's make sure we understand what's going on here. So the first thing to realize is you have an injury. And in fact, you don't even really have to have an injury. You can have a perceived injury. You can think something is going to cause you pain and have amplification of those symptoms. So we go into this area right here where I have threatening information, and people have a choice. We all have a choice to either catastrophize or go into a low fear pain route right here. But what does every person do? And you can't help it. I see a bunch of people in the audience. Put your hand up. How many of us catastrophize? Okay. It's the first thing that most people do. So what happens when you catastrophize? You get stuck in this fear avoidance behavior of hypervigilance. You don't want to move because you think it's going to hurt, disuse and depression, and then you get into injury and pain. And this cycle continues around, and you can hear it in people when you're talking to them. What do you hear? They can't visualize future wellness. It's if I get better is what the person is actually saying. They feel alone. They feel isolated. What is our job really? Our job is to be a team member. One of my favorite things that we actually talk about is if illness, what is it? If I is replaced with we, illness becomes wellness.
Mhm.
So we've all seen that one before. We are here to help. And in fact, even on these little booklets, it actually says that. That's my big thing. You can do it. We can help. What are we trying to do? We're just trying to push you in a direction, be cheerleaders effectively to get you to this low fear area right here. So that pushes you over to this side of the drawing. So you get into low fear and return to activity and then recovery. And it doesn't matter what the injury is. You can have depression. You could have ankle sprains, low back pain. You can have heart attacks. The sooner I get you back to regular activity, the better the outcomes are across the board. So what am I looking for? I'm looking for visualization of future wellness and the person to actually say to me, when I get better. And once you make that transition, when I get better, then you've already won about half of the battle right there. Of course, you have to rule out red flags and other concerns there, but those are key things for us to get.
Amazing. I love how empowering that is. It almost doesn't even matter what the injury is. It's all the same at the start.
That's right. Absolutely it is. It is all the same at the start, and we can break it down. In fact, if you look at it, if you want to go into diagnostic imaging and looking at, well, here's another example, pieces of the pain puzzle. This is I don't even remember what page this is on, but whatever. You have tissue damage that takes place. So what happens? Well, there's a whole bunch of things that can influence your pain. And if you want to talk about the injury, the X-ray or MRI results, there is research that says, if I read an MRI to you and I give you big, scary words, guess what? Your symptoms get worse. And there's a lot of fear mongering out there where people will read these MRIs and X-rays to patients, and all of a sudden their symptoms get worse. Or even better yet, if I tell you as the clinician that things are going to take about 6 to 8 months to get better, guess what? It already flicked the switch in your brain where now it's going to take 6 to 8 months, and that's your expectations. Expectations are huge. So the first thing to realize, you're not alone. We're here to help. The second thing to realize, if it's a common condition, tell the patient that it's a common condition. Lots of people have that. There's lots of different things you can do.
Mm-hmm.
And then the third thing to realize is celebrating the small victories. So if this is a patient that came in, she's a new mom, she had a disc herniation that actually occurred. She went to the ER. And what did they tell her to do at the ER? They gave her morphine and T3s. So she couldn't actually breastfeed. If you go onto YouTube and you type in Vizniak low back pain, I actually put this case up on YouTube there so you can just watch it, where she talks about her own experience. So she was given these heavy drugs that prevented her from actually going into breastfeeding, and she was told to lose weight and see you later kind of thing, right? That's where it was left right there. So she comes in to see me. She's actually carried in with her husband almost, can barely put any weight on. And the first thing we do is we do a detailed history, talk about how things are going for her. And we do just some simple range of motion treatments. And within 15 minutes, I can take her from a 9 out of 10 pain level to a 4 out of 10 pain level and have her much calmer and more relaxed in herself and in her body. And one of the big things that I look for outcomes in patients, yeah, pain is great. You can see it decrease, but can I decrease your medication intake? That's the big thing that I'm trying to accomplish with lots of my patient visits. Can you take less meds, therefore be in a better state of homeostasis and balance, right? And that's what we're looking for a lot of people, especially in America, because I practiced in America for a long time. What do you see there? I cannot believe how much the drug companies are marketing to the general population there, because their ideal client is somebody who is on medications for life. They don't care about curing disease. They care about you refilling your prescription again and again and again. And if I can get you on 2 or 3 different drugs, even better. If I can get you off of them, that's where I'm going with this whole visit, with this whole issue, right, that we're dealing with. So,
Right,
yeah,
exactly.
just thought I'd share that really quick. So,
yeah, that's so powerful. And Michelle made a comment that, mindset matters. It's true, right? Like if we've seen something over and over again and a client patient comes in and they're devastated because the amount of pain that they're in, and they're feeling desperate and their brain's not working in their benefit at that moment because of the neurology that's occurring as well. And we can let them know this is super common. It's not my first time at this rodeo. I know it's yours. This is what I say.
Yep.
I know it's your first time in this pain, but I've seen this before and I've seen them all get to the other side. You can do that too. You just feel them kind of shift in that moment. And that's when you can start doing something. Until you can get them to that neurologic state, you shouldn't even touch them yet.
That's
We're
right.
not
And in
ready.
fact, you're bang on with it right there, Gina. In fact, you can even see it when the patient sits in your office or they're laying on the table, however you have to do your exam. If you can just get them to breathe, you can see a little bit of breath, a little bit of breathing, calming down. They come in, they're jacked up and they're all like, oh, what's going on? I don't know if I'm gonna get better. You can see the change. Half of your visit already happened with the questions that you ask and the words that you choose to use with the person sitting there before you even put your hands on them. Absolutely right.
Yeah, exactly.
Yeah.
Amazing. I
So
love
right.
that you have the research behind it too. That's so powerful.
Well, yeah, so this is what I was going to share right now is just a few other items on this. So if you're looking,
Right.
you should be looking at a screen right now that says words matter, I hope, or not.
Not yet.
No, I went to the wrong one. Okay, give me 2 seconds to find it.
Yeah, go for it.
Words do matter. Absolutely. Can you see that now?
Yes.
Words matter. So we're going to use low back pain as an example with the reference down here below so you can see it. 89% of persistent low back pain cases are learned beliefs from healthcare professionals.
Right.
That means you're feeding them lines to actually create dependency on your treatment is what a lot of people wind up doing. The words that are used are broken machine, permanent damage, we can't change, very negative or complex. Okay, when you start saying, well, back pain is complex, well, pain is complex, that already flicks that switch in the person's mind. Well, if it's really complex, I'm probably not going to really understand it that well, and what can I do for my functional outcomes? Keep it simple. And one of the most favorite things that I do in practice is celebrate the small victories. People don't even realize how things have changed for them when they first came in to see you to a few follow-up visits. So you definitely want to celebrate those small victories. Okay. All right. What else? Yeah. Stop teaching dependence. Start instilling resilience. You can bounce back from this. You can get better. What do we have going in your favor? Well, you eat pretty well. You're coming in now and we can go ahead and get you on a little exercise routine. You're starting to find the right people as part of your healthcare team. That's how we build resilience. If you're there by yourself with isolation, then you're going to see really negative outcomes for that person. So again, we are here to help. You can do it. So you instill it in the patient that they can be resilient. I'm just here to be a guide for you on your journey through this process with the research and everything that I have. Yeah, patient's belief, predict patient function. I'm just going through some of our Instagram posts that we put up, Clinician bias influences patient beliefs as well. So we also have to watch our own biases, right? One of my biggest pet peeves for chiropractors in particular is I'll see you 3 times a week for the next 6 weeks, and then we'll go on from there. No, you do not need to have this ultra high, crazy visit frequency. What you need to do is see them once, see what's going on, do a quick follow-up, and then go ahead and maybe draw out the treatment plan a little bit longer so it's not as frequent and not such a financial burden on people. You can see a lot of practices are built as businesses and not actually healthcare. They're more disease care, like you see with a lot of pharmaceuticals.
Amen.
Yeah, and this is back to this one right here that we've already seen, so not a big deal. One of the key things is to celebrate these small victories with patients. You have to have outcome markers that you can measure. So simple things like pain scales are good, medication or botanical use is good. Centralization of symptoms. Oh, the pain used to go all the way down into your fingertips, and now it's only coming to your elbow, and now it's coming up into your neck. Those are good signs. Get excited for your patients when they see that, okay? Oh, you know what? You used to have headaches 3 times a week, and now you're down to 1 headache every 2 weeks. Get excited. Tell them this is a good thing. They are on a winning strategy right here. I had one patient last week come in, and well, this is like from a month ago. She had headaches for 50 years. Every day she would get a headache. And so she came in, she goes, well, you know what? I'm only getting a headache once a week right now. So that's pretty good. And she wasn't even excited about it. So I was like, full stop. You understand what this means, right? You've had 50 years of this kind of symptomatology where you're taking Tylenol, aspirin all the time. And now you're going to 1 headache per week. You say, oh, wow. I didn't really think about it that way. And then so you make that little light bulb moment so things are getting better for that person, right? Of course, with the pain patterns that we're looking at for people, you want to make sure that you're not missing a more significant red flag. And so you want to make sure that you're not missing, visceral pain referral patterns. One of the worst things that you can see happen is you think it's a simple musculoskeletal thing and you're missing a heart attack or something else like that because the referral pattern. So usually 2 or 3 visits, if I'm not seeing results, I know that I need to go somewhere else with this person and look maybe referral or maybe have more diagnostic imaging or something then. Okay. And on the diagnostic imaging thing, I just want to say this because the general population believes that X-rays and MRIs are 100% accurate. They also believe that when it's done, if it shows something on the MRI, it has to be the cause of my pathology. So this graphic right here shows you cervical disc bulges. They occur in asymptomatic. That means Normal people, 30 to 90% of the time effectively. Shoulder anomalies in 96% of the patient population, okay? Disc issues in anywhere from 37 to 96, and it goes on and on and on like this. There's one great study that was done where a person walked into 10 different MRI suites and had 10 MRIs done, the exact same person. They did it over a 2-week period, and none of the findings were similar on any of the MRIs. So that means what people are doing, what radiologists are doing, they're being paid hundreds of thousands of dollars to do this. They're describing a picture that they see, and they have no clinical interaction with the patient usually. So my biggest thing when you're dealing with pain and you think an MRI is going to cure or a X-ray is going to be part of your curative process, it's usually not. And in fact, those things are often overused. The main result that you want to get out of this is treat the person, not their pictures. Treat the person, not their pictures. That's a statement I'll use with patients. If you guys are watching right now, make a screenshot of this little image right here. It shows you with, I don't know what we cited here. They're all systematic reviews. So they're big, good research articles. I don't know, I got like 10 articles on this page right here that you can look at to reaffirm that. Okay. Bottom line is this. If I is replaced with we, illness becomes wellness. We are here to help. We are not here to make money off of you, although we do get paid for what we're doing. You're not going to be creating a treatment plan based on, you know, how it's going to fit into your schedule or anything. You're going to be creating a treatment plan in the best interests of the person that you're working with. And as long as you do that, you're never going to be short of patients. There's no shortage of injuries or damage or anything like that out there in the world. So don't feel like there's a scarcity for any of this content, okay, for any of these injuries. Yeah.
Amazing. Dr. Nick, you brought in so many concepts that we've been talking about this week and wove them all together, from the nervous system to messaging and being able to communicate in a clear and compassionate way, to seeing someone in their wholeness, making sure we're not treating them broken, we're treating them whole. We're seeing them in that way, not getting enrolled in their story. That's what I talk about in my training program. It's fine for you to tell me the details because I need the history, and then we're going to shelve that. And now we're going to work on from this moment forward.
Yep.
And then you have the research to back it up. I mean, you really touched on bringing it all full circle for us. Thank you for that so much.
Thank you. Yeah, it's my pleasure. I mean, that's what we did. Like even this is the new massage therapy book right here. Did I send you this one? I don't think I did.
I don't think so. No.
It's like 1,200 pages that walks through how to manage all the conditions. And the underlying theme is biopsychosocial, holistic approach and viewpoint of the patient. And then you can look at specific exercises that you might do or treatment options that you might do with it. But again, it has to be meeting the person where they are.
Yeah, amazing. The chat's lighting up. People are loving your energy, loving your approach. We love your energy, of course. Bethany, my assistant, thank you so much. She put your gift in there for all of us. So you gave us 2 gifts, right? Because that's just
I forget. I had some of our staff go ahead and set it up. Like people don't even realize if you go to our website, if you go to the prohealthsys.com website, you will get lost on over 1,400 web pages, full Grey's Anatomy, all videos of all the orthopedic tests and everything. Like it's crazy the amount of resources we have there. So
again, not sure how you did it. Super inspired. That's amazing.
It's been a 20-year journey. And of course you don't do it yourself. I mean, I have all kinds of co-authors and other people who are helping me do this as well. Gina, I'm sure we're going to do something together in the future. So I'm more than happy to help people out. And the other thing I just want to point it out there for people too. If you're watching this and you're like, hey, Dr. Nick, you know what? You've got all these images. Could I just borrow some of those images and use them? Yes. I give people copyright permission to use our images a lot of the time.
Wow.
If it's for the benefit of patients, that's what we're doing here. Okay. I'm not here trying to lock stuff down and saying you can't share this and you can't use that. Like these exercise posters, we have them up in our clinic. And what I let patients do is I'm like, I want you to do this exercise and this exercise. They take a picture of it on their own phone and then they demonstrate it right there. And you don't overload them with a bunch of stuff, but you give them some basic things to use. People are always struggling for good resources. What's copyright free and what can I actually use? You can just direct message me and I'll say, yeah, go ahead and use this. As long as you have credit, I don't really care actually. So yeah. Right.
That's amazing. And Beth, my assistant, put a note in there. I love the mentality of generosity. Generosity begets generosity. There's no reason to have scarcity mindset. And, we all have that. And that's, again, looping us back to what's going on in the nervous system. We don't come out afraid. We learn to be afraid. So there's something that's going on. And if we can lean in and say what happened instead of what's wrong, we might get closer to a solution.
For sure.
Dr. Nick, I feel like there's so much more you could share with us, and I know we only have a couple minutes left. Is there anything else that you want us to know that we need to know before you leave? If in case we never, unfortunately, some of us might not get to cross your path again, what would they need to know?
The only thing is find resources and mentors and people that you trust that you can send patients to, because again, none of us can do any of this by ourselves. We're always looking for good people that we can circulate and send other patients to. What I typically will do is, number one, they're probably former students of mine that I'll recommend, because you can tell personalities are going to match up pretty well, since I've been teaching for 20 years, doctors and therapists. The other thing is go and create your own healthcare network. Go and offer free treatments for your local healthcare providers. You give free treatments to them so you can really see what all of you are doing, because a lot of people don't even understand it. Let's say if you're a massage therapist, all they think you do is you're just rubbing backs all day. They don't think that you actually have skill set and other knowledge that you might actually have, especially here in BC. Massage therapists in BC have more anatomy training than medical doctors do. Right. And if you're spending an hour with a person, you probably know that person a lot better than somebody who's seen them for 5 minutes, 10 minutes, 15 minutes. So you really understand their story. You can make a better connection. And it's connections with other healthcare providers and your patients that's ultimately going to make the biggest difference for people.
Amazing. We talk about that a lot in our program. Partner. You got to partner with everybody. Partner with other colleagues, partner with your community, partner with your client and patient, partner with everybody. Amazing. So people have been asking for your email address, and my assistant's on it like she always is.
Yeah. So but the best way to get a hold of me is not email, because I get like 50 emails in a day. So the best thing for you to do is actually just go follow me on Instagram or Facebook and direct message me, because I can get back to you way faster that way. And it's simpler because it's little quick things, and I have all the images on my phone and stuff like that I can send you. So it's at Nikita Vizniak. So I just use my full name. Yeah, at Nikita Vizniak on Facebook, at Nikita Vizniak on Instagram. Luckily, Vizniak is a distinctive name. So even if you go on a YouTube search, you want to learn or remember how to evaluate a shoulder, there's a full shoulder evaluation right there in 10 minutes or less. I take you through the whole process, right? So yeah, so all that's available for you guys to look at and find those resources. I'm pretty active. I always post a lot of stories, so my 24-hour stuff. But if there's anything you would like to see me post, anybody out there, I will respond to what you guys want, what you need. So if you want to see, hey, can you show me some rehab for what we're just looking at? Glute activation, right? We're looking at innervations for better standing, because I'm also a yoga instructor. I'll post a bunch of stuff on yoga teaching, or Tadasana, which is that standing mountain pose, which is very similar to what we were seeing Madison do there before. And his excellent descriptors that he was giving were fantastic. So yeah.
Mm-hmm. Wow, amazing. So we have your Instagram now in the chat and your YouTube link.
Yep.
Again, I don't know where in your 4 things where you divided your time. I'm not sure where you have time to do that. I feel like I'm in your business, because I just don't understand how you get all of it done, but I'm super impressed.
You want to hear about this morning? I'll tell you about this morning.
Okay.
This morning was this. So if you can see how the day goes, this is the way this morning went. This morning went, get up. I just did a quick outline of the key things I wanted to cover for today's conversation. Then I took my kids to school. Then a truck came and delivered about 5,000 textbooks to us. And literally 20 minutes before that, I was in here. And so you can see it right now.
Wow.
This is how it gets done. Okay. All right. Yeah. Okay. That's how it gets done. So you do a little bit here, a little bit there. You got to have fun with it. And I hope you can all get that from me. I am enjoying my time, and all I really want to do, why do I write the books? I was frustrated as a student. I'm just looking for good resources that are going to make a difference for people. Yeah.
You're seriously the best. I'm so glad that you're the best. I'm so glad that I know you. You're making the world a better place, Dr. Nick, in more ways than one. I appreciate you so much.
Thank you. We all are making the world a better place. Hopefully that's why everybody's here, even looking and observing this, right? We all want to make ourselves better, and we can all learn something from somebody else. So.
Yeah, exactly. Okay. So we get to collaborate in the future. I can't wait to see what that is. I'm going to definitely be on power speed to be able to keep up with you, but I'm up for it.
All right.
Do it.
Okay. Super cool.
Dr. Nick, thank you so much for your time. I'm not even going to come close to keeping you over a minute, because I know what that'll do for your schedule. So.
Yep. All right. Thank you very much. I appreciate your time, and we'll see you guys in the future. Feel free to reach out. More than happy to help.
All right. Awesome. Thank you again for all the generosity. We appreciate you. Bye for now.